Hello friends, welcome to our channel Nurturing with Yoga. Today I am going to tell you about the vitamin D. So I'll cover all the stuff related to vitamin D today, like what are the sources of vitamin D, why it is required for our body, what are the effects of deficiency of vitamin D, all this stuff. So I'll request you all to stay with my video till the end. It may be the longer video, but I'll request you all to please stay with the video so that you'll get all the information of it. So let's start with the video. So first of all, what is it, right? So vitamin D is a fat soluble vitamin that is naturally present in a few foods added to other food items like fortification and available as dietary supplement also. Now vitamin D is both nutrient we eat and a hormone our bodies make. It has a very high significance value in terms of helping the body to absorb calcium. It is also produced endogenously, like inside your body, when ultraviolet rays from sunlight strike the skin and trigger vitamin D synthesis, and therefore it is regarded as sunshine vitamin. Now come to the forms of vitamin D. So there are three forms of vitamin D. One is your D2, then D3, and then DTH. Alright. Now what are those? First one is D2, which is called ergocalciferol. It's also known as provitamin D and it is found in plants, mushrooms and yeast. Next comes to D3, which is called cholecalciferol. This form is found in animal food such as fish and eggs. Next comes to DTH, which is dihydrotestosterone. This is a synthetic form. Now one may question that why vitamin D is considered as hormone. So vitamin D is now believed to be a hormone rather than a vitamin because there are certain reasons for this. One is vitamin cannot be synthesized by the body at all or only synthesized in adequate amounts. It is produced in the body from cholesterol, like all other steroid hormones like estrogen and progesterone, etc. And its mechanism of action is similar to these hormones. Third, it regulates calcium metabolism and bone formation. That's the reason it is considered as hormone. Now come to the functions. Alright. The most important function is called calcium absorption. What is that? Vitamin D is essential to trigger the calcium absorption in the liver and intestine. And for this reason, when you purchase any sort of calcium supplement, you might have noticed that most of the time it may contain small amount of vitamin D. Now why this vitamin D is added to the calcium supplement? So it is helping actually to absorb the calcium. So that is the main reason to add the vitamin D in the calcium related supplements. Secondly, you can consider as it helps in calcium deposition in the bones and it has been shown that to greatly reduce the fracture risk of it. Third, you can take as it helps maintenance of healthy skin. Then it enters muscle cells and enhances the cell's contraction ability. Hence, it's making it stronger. After that, low levels of vitamin D interfere with the effectiveness of your fulfilling hormone leptin, which can lead to prolonged hunger despite eating. What does it mean? Now, if you are having lower vitamin D in your body, even if you eat, you'll feel hungry for prolonged time. That is the main reason. Next comes metabolism. And vitamin D can be obtained from sun exposure, foods and supplements. However, it is biologically inactive and must undergo 2 additional steps in the body for activating so that it can be used by the body. Now how it is done, I'll come to that in a process chart. Now you can see the flow chart over here. This is how it is getting absorbed in our body. So first is sunlight. Sunlight, what it does, vitamin D3 or cholecalciferol is synthesized in the skin from provitamin D3, which is called 7-dihydrocholesterol, which following exposure to ultraviolet B, and it is the ray from sunlight. Next comes to diet. Now dietary vitamin D2 and D3 are absorbed in the small intestine and are converted into their active forms in 2-step process. What are those? Step 1 is liver, which is here. Now in liver, vitamin D3 and D2 are respectively metabolized to 25-OH D2 and 25-OH D3, also known as calcidiol. or 25 hydroxy cholecalciferol. In fact, the level of circulating 25 OHD in the body is usually considered as the indicator of vitamin D status. Next comes to kidney. Now here 25 OHD2 and 25 OHD3 are further converted into 125 OH2D2 and 125 OH2D3. This active form achieved after these two steps is known as 125 dihydroxy cholecalciferol or calcitriol. Now this is the flowchart how vitamin D is getting absorbed in our body. Now level of the synthesis in the skin influenced by many factors including the season of the year, level of air pollution, skin pigmentation, latitude, use of sunscreen, type of clothing, and amount of skin exposed. Since vitamin D is stored in the fat tissue, body fat composition may also play a role in low levels of circulating vitamin D. Now what are the sources? I'm coming into that. Few more points as a function you can consider as it aids in absorption of calcium, as we know from the intestinal tract. It helps body assimilate phosphorus, helps the pancreas release insulin, necessary for blood clotting, necessary for growth and development of bones and teeth, then necessary for thyroid function. It stimulates bone cell mineralization. So all this you can also consider as function of vitamin D. As far as sources, we can consider as animal-based, plant-based, and sunlight. Now sun exposure is the major source of vitamin D, as we all know. Next it comes to animal based. Now fatty fish such as salmon, tuna, mackerel, small amounts of beef liver, cheese and egg yolks, fortified milk is considered as animal sources. Then come to plant sources, which comes under like pulses, mushrooms, fortified breakfast cereals, fortified soy beverages, all this stuff. Now, an average of 80% of dietary vitamin D is absorbed by both infants and adults. Then certain marine fishes such as salmon, sardine, tuna, herring, mackerel, etc. are known to be good sources of vitamin D. Now, recent work indicated that even freshwater fishes have moderate amounts of vitamin D3 in liver. And apart from the sunlight, the other sources that can help in meeting the RDA easily is your vitamin D supplement. Now in fact, studies have shown that women who are pregnant and deficient in vitamin are often at a greater risk of recurring a C-section, but they also showed that pregnant women in too much of vitamin D can be associated with the increase of food allergies in their children within the initial years of life. So that's how it's working. Now come to the vitamin D receptors. Now vitamin D receptors are located in your bones, pancreas, intestine, kidneys, brain, spinal cord, reproductive organs, then thymus, adrenal glands, pituitary gland and thyroid gland. These are the places where vitamin D receptors are stored. Now come to the symptoms of vitamin D deficiency. What are the symptoms? Like bone disorders, which is called like rickets in children and osteomalacia in adults. Then decreased calcium levels, decreased phosphate levels, increased risk of osteoporosis, then muscle spasms. These are all symptoms of vitamin D deficiency. Now come to the causes of deficiency of vitamin D, like aging, which causes your body to make less vitamin D from the sun. Then decreased fat absorption as a result of short bowel syndrome, then sprue or certain medications, then fat blocking medications and over the counter fat blockers used for weight loss, then medications such as phenytoin, prednisone, which is a steroid, treats cancer and interferes with the conversion of vitamin D to its active form, then sunscreen, which prevents the vitamin D absorption. These are the basic causes of vitamin D deficiency. Now diseases. What can be the disease if you have deficiency of vitamin D, and what can be treated with vitamin D? Like autoimmune diseases, cancer prevention and treatment, cardiovascular disease, depression, diabetes, epilepsy, then hypertension, which is high blood pressure, inflammatory conditions, migraine headaches, then multiple sclerosis, then musculoskeletal pain, osteoarthritis, osteoporosis, polycystic ovary syndrome. So these are the diseases if you have vitamin D deficiency. Now we'll discuss about few common diseases, which is osteoporosis and osteomalacia. What are those? So first come to the osteoporosis. Osteoporosis is the disease of bone most frequently encountered by old people. It's a disease that weakens bones, making them more prone to fractures. It can be caused by low level of hormones such as estrogen in women, calcium and vitamin D deficiencies, and then lower levels of physical activity can contribute to an increased rate of bone loss. Then come to osteomalacia. Now osteomalacia refers to bone softening. So it is commonly seen in women. Such women are childbearing age, consume cereal-based diets, poor in vitamin D and calcium, and receives less sunlight. First pregnancy is the most common time of occurrence of osteomalacia. Now, what are the RDA recommended dosage for vitamin D, which is recommended dietary allowance? So, if the RDA we consider, we can find that vitamin D in case of minimal sun exposure is of 600 IU per day for men and women. Both of them are required, like 600 IU. Then come to toxicity. Come to this one. So too much of vitamin D can make the intestine absorb too much of calcium, which may cause high levels of calcium in the blood, which can lead to calcium deposits in the heart and lungs. Then confusion and disorientation. Then damage of the kidneys, kidney stones, nausea, vomiting, then constipation, poor appetite, weakness, weight loss. If a vitamin D is taken 500 to 1000 times larger doses than normal over a prolonged time period, then this is a high risk of toxicity. The symptoms include like thirst, anorexia, constipation, nausea, vomiting, hypercalcemia. These are the symptoms for this. Now we'll discuss with few common questions which are very common that people are asking. First question people are most of the times asking when I am talking to them, I got to know the best time to be in sunlight and how long. So the best time for sun exposure is from 11 am to 2 pm, and sun exposure should be for 20 to 30 minutes. However, overexposure to the sun can lead to skin damage and increased risk of skin cancer. So it's important to always be mindful of the amount of time you are spending in the sun. So that's the first question. Now the second question I have been encountered with, most of the people are asking me like, can food fulfill vitamin D requirement? So it is difficult to fulfill your vitamin D requirements through food alone, as most of the natural foods have negligible amounts of vitamin D. Even popular food sources such as egg yolk, butter and milk are the best poor sources. Now some foods that contain decent amount of vitamin D include fatty fish as well as the fortified foods like milk, cereal and orange juice. However, it can be difficult to get enough vitamin D from these sources alone, especially if you have limited sun exposure or darker skin or both, as they reduce the amount of vitamin D produced in your skin. The next question I've been asked like, can you increase the vitamin D content of mushrooms? The answer is to that, like exposing mushrooms to sunlight can increase their vitamin D content. Mushrooms, like humans, can produce vitamin D when their skin is exposed to UV radiation. Mushrooms are exposed to sunlight or other sources of UV radiation for 15 to 120 minutes. They can produce significant amounts of vitamin D2, which is ergocalciferol. Now next question asked as, are eggs good source of vitamin D? The amount of vitamin D in eggs yolk can range from 18 to 13 IU, which is international units, which is about 5 to 10% of the recommended daily value of vitamin D for adults. Whether this is a good amount depends upon your overall vitamin D intake from other sources as well. So therefore they should not be relied on as a sole source. You should be taking other sources as well to fulfill your vitamin D requirement. Next question is, should we use sunscreens? Now wearing sunscreen can reduce the amount of vitamin D that your skin produces when exposed to sunlight. Sunscreens work by absorbing, reflecting or scattering the UV radiation that causes sunburn and skin damage. However, these same properties can also reduce the amount of UV radiation that penetrates the skin and triggers vitamin D production. Few research suggests that wearing sunscreen with protection factor, which is SPF 15 or higher, can reduce the vitamin D synthesis by up to 99%. However, exact reduction in vitamin D synthesis can be vary depending on the factors such as amount of sunscreen applied, the time of day you're applying, and the season. Now, despite this, it is still important to wear sunscreen to protect your skin from harmful effects of UV radiation. There are several ways to maintain healthy vitamin D levels while still using sunscreen, such as spending time in the sun without sunscreen for a short period of time, taking vitamin D supplements, and consuming vitamin D rich foods. So that's all for today. If you like my video, please do subscribe to my channel, like it, share it, comment it, and don't forget to press the bell button so that whenever I post a new video over here, it gets notification of it immediately. Thank you so much for being with me till the end of the video with patience. Thank you so much for your love and support. I will give my Instagram profile and Facebook profile, at the same time LinkedIn profile in the below. Thank you so much. We'll meet with you soon with another video. That's all for today.